eventually, I concluded a few things. One, as I said earlier, surgery is not an option. Morton's neuroma surgery is the only surgery that purposely cuts a living nerve, and that's because cutting a live nerve frequently has nasty complications. Alcoholic sclerosing injections, where very low dose alcohol is injected directly into the Morton's neuroma, is also not a solution. It just ends up irritating the nerve. It doesn't really achieve anything aside from creating more scarring. Cortisone injections, as I said earlier, are only temporary and become less effective the more you have them. And they have the very real risk of fat pad atrophy, which, as I said, is nasty. Morton's neuroma can be very difficult to diagnose because about 1/3, that's 1/3 of the population has asymptomatic Morton's neuroma. In other words, about 1/3 of the people just have Morton's neuroma. They don't know it. They don't have any problems at all. So just because you have a Morton's neuroma on your MRI or on your ultrasound doesn't mean that the cause of your foot pain is Morton's neuroma. It's just like saying, just like with your appendix, just because you have an appendix doesn't mean that every stomachache is appendicitis. So my biggest conclusion and the bottom line is that the best treatment for Morton's neuroma by far is ultrasound-guided ablations. Either ultrasound-guided cryoablation, ultrasound-guided radiofrequency ablation, or ultrasound-guided neurolytic ablation. I had all three. The other important conclusion I reached is that it's really hard to figure out how to treat Morton's neuroma. I'm a trained physician. It took me 2 years to figure out how to treat this thing. I was thinking about, what about all the other people who are not physicians, who are not medical? How are they going to figure out how to treat this horrible, debilitating condition so that they can just get on with their lives? So I started this center with my wife, Dr. Janet Pearl, who is also a physician, so that we could help other people like me regain their lives.